Hi everyone, Gerard here with Patron Cyber Security. Today we're going to discuss what medical practices must do after a HIPAA breach to prevent fines and stay secure. Okay, so healthcare practices across the US are becoming prime targets for hackers. Recently, the Retina Group of Florida on the 3rd of September of 2025 reported a cyber attack. This exposed more than 150,000 patient records. This was posted on the official HHS Breach Portal. So, what happens when a breach occurs? What do regulators expect from you? And more importantly, how do you avoid being in that situation in the first place? That's what I will walk you through today. So let's start with, why are cybersecurity criminals going after healthcare? Well, for one, patient data. Now, this is worth more than credit cards on the dark web. Even a small practice stores social security numbers, insurance details, and medical histories. So most practices don't have the same defenses as large hospitals. Now, that's why eye doctors, dentists, dermatologists, and small specialty groups are now prime targets. So basically, hackers know that you're busy, understaffed, and often running outdated systems. So what happens after a breach? When a breach like this happens, here's what follows. So number one, you're required to report the incident to HHS under the HIPAA rules. Number two, the patients must be notified and what damages have been done. Number three, regulators ask for proof. Your HIPAA risk assessment, patching records, monitoring reports, and security policies. If you don't have those ready, the fines and the penalties are almost guaranteed. Here's the thing. By the time a breach hits, it's already too late. That's why prevention is the smartest play. Actually keeps practices out of trouble. Annual risk assessments, very important. These are required and not optional. The 24/7 monitoring and endpoint protection, very important and required. Automatic patch management, so vulnerabilities don't unaddressed. Compliance reporting that you can show to the regulators or the insurers at any time. Think of this. Breach response is expensive. Prevention is predictable and far cheaper. Here's some common mistakes clinics make. These are mistakes I see most often when I review practices. And keep in mind, I have been in cybersecurity specifically for over 15 years. Another thing, forgetting about staff training when phishing emails are still the number one way attackers get in. Each one of these mistakes can lead to exactly the kind of breach we saw in Florida. How can Patron Cyber Security help? At Patron Cyber Security, we built our services to close these gaps. We provide annual HIPAA risk assessments that identify the vulnerabilities, 24/7 managed endpoint protection through our Secure2 platform, automatic patch management across your systems, monthly compliance reports you can hand to auditors, insurance, or your own leadership, and guidance on written information security policies and staff training. So basically, our goal is to give small and mid-sized medical practices the same level of security that big hospitals have without the massive cost. Real-world scenarios. Let me give you a few quick what-if examples. What if ransomware locked your patient scheduling system tomorrow could you prove that you had safeguards in place? What if an OCR auditor requested your last HIPAA risk assessment? Could you produce it? What if a patient sues after their information leaks? Would you have documentation showing you did everything reasonably possible to protect them? These are not theoretical, they're real situations that practices face every year. So what must medical practices do after a HIPAA breach? You need to be ready with risk assessments, monitoring, patching, and compliance documentation. But the better answer is to do this. Don't wait for a breach. Build those safeguards now. Subscribe to this channel. If you have any questions about our services, check out the Calendly link below.